Irritable bowel syndrome. The best treatment options. Irritable bowel syndrome, IBS, is a group of symptoms, including abdominal pain and changes in the pattern of bowel movements without any evidence of underlying damage. These symptoms occur over a long time, often years. It has been classified into 4 main types depending on if diarrhea is common, constipation is common, both are common, or neither occurs very often, IBS-D, IBS-C, IBS-M, or IBS-U respectively. IBS negatively affects quality of life and may result in missed school or work. Disorders such as anxiety, major depression, and chronic fatigue syndrome are common among people with IBS. The causes of IBS are not clear. Theories include gut-brain axis problems, small intestinal bacterial overgrowth, genetic factors, food sensitivity, and gut motility problems. Onset may be triggered by an intestinal infection, 5, or stressful life event. IBS is a functional gastrointestinal disorder. Diagnosis is based on signs and symptoms in the absence of worrisome features. Worrisome features include onset at greater than 50 years of age, weight loss, blood in the stool, or a family history of inflammatory bowel disease. Other conditions that may present similarly include celiac disease, microscopic colitis, inflammatory bowel disease, bile acid malabsorption, and colon cancer. There is no cure for IBS. Treatment is carried out to improve symptoms. 8. This may including dietary changes, medication, probiotics, and counseling. Dietary measures include increasing soluble fiber intake, a gluten-free diet, or a diet low in fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, FODMAP. The medication loperamide may be used to help with diarrhea while laxatives may be used to help with constipation. Antidepressants may improve overall symptoms and pain. Patient education and a good doctor-patient relationships are an important part of care. About 10 to 15% of people in the developed world are believed to be affected by IBS. It is more common in South America and less common in Southeast Asia. It is twice as common in women as men and typically occurs before age 45. The condition appears to become less common with age. IBS does not affect life expectancy or lead to other serious diseases. The first description of the condition was in 1820, while the current term irritable bowel syndrome came into use in 1944. Having irritable bowel syndrome, IBS, can take a toll on your life. You can have constant pain and pressure in your stomach that can make doing activities with loved ones nearly impossible. You can also experience the symptoms of constipation or diarrhea, depending on what type of IBS that you have. Getting treatment from a doctor is the best way to live your life to the fullest with IBS. Treatment for irritable bowel syndrome focuses on relieving the symptoms that people feel from the condition. This is because the exact cause of IBS is not known, and there is no known cure. Treatment will depend on the type of IBS you have along with the severity of your symptoms. You should never try to treat IBS yourself. Alternating between medicines can actually make the symptoms worse over time, and your doctor will know how to treat your unique symptoms without causing them to become worse. Your doctor will prescribe you medications if you have moderate to severe symptoms of IBS. It is important to take only the dosage that they give you and do not take any medications for your symptoms without consulting your doctor first. One common medication that doctors will prescribe if you have IBS with constipation is a fiber supplement. These supplements will help control the constipation and will not cause as much bloating as fiber-rich foods do. There are also medications for people with IBS with diarrhea. The anti-diarrhea medications like Imodium can help control diarrhea. This can lessen the chance for an accident caused by IBS with diarrhea. Many doctors will prescribe a low-dose antidepressant to their IBS patients. This does not mean that you are depressed. These low doses of antidepressants can block signals of pain to the brain that are caused by the gastrointestinal nervous system. Doctors will usually recommend antidepressants like Tofranil and Pamlar. Some of the newer antidepressants like Paxil and Prozac can cause diarrhea. Be cautious of those if you have IBS. Many people do become depressed because of their condition. This is because IBS can be embarrassing and take a toll on a person's quality of life. This is another reason for the antidepressants. Other types of medication that are used in the treatment of IBS are called anticholinergic and antispasmodic medications. These medications are used to help relieve the pain from bowel spasms. They can also be used for people who have bouts of diarrhea. Some common medications are called Levsin and Bentyl. These may worsen constipation, so be careful with these medications if you have IBS with constipation. One of the most common triggers for IBS symptoms is stress. It is important to manage your stress if you have IBS so you do not exacerbate these symptoms. You should talk to your doctor about behavioral therapy if that is a stress management route that you want to take. You can also reduce stress on your own by exercising, getting enough sleep, and having a balanced diet. You should also try spending a majority of your time doing activities that you enjoy and that keep you relaxed. Diet is essential when treating IBS. You can try eliminating high-gas foods and gluten from your diet. Some items to cut out include carbonated beverages, wheat, rye, broccoli, raw fruits and fructose. Some vegetables like the ones listed above are high-gas foods. They also do provide essential nutrients. Talk to your doctor about getting proper nutrition if you have to cut out foods that usually provide the nutrients for you. Living with IBS can be difficult and talking with your doctor about the symptoms that are occurring can be embarrassing. Even though it is difficult, there are many treatment options that are available that can help you live a normal life with IBS. Make sure to get medical help when symptoms start so your doctor can provide the right treatment regime for you. Symptoms of IBS. Most people with IBS find their symptoms an occasional nuisance but don't feel the need to see a doctor. However, for some people the condition seriously affects their quality of life. If you find it difficult to cope with your symptoms, visit your GP for more advice. People with IBS often continue to get symptoms from time to time, and these symptoms include pain. The most common symptom of IBS is pain or discomfort in the abdomen, such as stomach cramps. The pain ranges from mild to severe, and may be made better by opening the bowels or passing wind. It is often made worse by eating. Pain may occur at a particular time of day, often in the evening. Women often find the ups and downs of pain seem to parallel and may be related to their menstrual cycle. Changes in bowel habits. Your feces may vary in consistency from hard and pellet-like to loose and watery. Alternatively, you may just pass small amounts of mucus. Your bowel movements may alternate between constipation and diarrhea. At times, you may feel an urgent need to open your bowels or this may feel strained. Afterwards, you may feel that your bowels haven't been completely emptied. Often, one IBS symptom will recur more often than the others, either pain, constipation or chronic diarrhea. Other symptoms. Other symptoms that are sometimes present in IBS include excess wind, nausea, indigestion, backache, tiredness, bladder problems. It's important to note that these symptoms are not specific to IBS. They may be caused by problems other than IBS, including celiac disease, which is a sensitivity to gluten, a protein found in wheat and other cereals, that can damage the lining of the intestine. If you have these symptoms, it is very important not to self-diagnose and to see your GP instead, who will investigate for the presence of celiac disease or other conditions. For more information about celiac disease and a gluten-free diet, click here. Causes of IBS. more frequent or stronger squeezing, contractions, of the muscles lining your bowel. Increased sensitivity to the gas inside your bowel. Your genetic makeup. Symptoms can be triggered by stress, whether it's from work anxieties, exams, relationship difficulties, or life events such as divorce or bereavement. They may get worse after eating specific foods and drinks, such as tea, coffee and fatty foods, for example. Antibiotics and non-steroidal anti-inflammatory medicines, such as ibuprofen and diclofenac, can also make symptoms worse. Diagnosis of IBS. It's important not to self-diagnose IBS because a number of conditions, such as celiac disease, Crohn's disease, ulcerative colitis and endometriosis, have similar symptoms. Your GP will ask about your symptoms and examine you and may also ask about your medical history. If you have typical IBS symptoms and are under 50, you may not need further tests. However, your GP might refer you for further tests if your symptoms can be linked to other bowel conditions. These symptoms include weight loss, blood in your feces, symptoms that first develop after age 60, a family history of bowel problems, diarrhea without other symptoms, anemia. Your GP may refer you for a sigmoidoscopy or a colonoscopy. This involves using an endoscope, a flexible, tube-like instrument, to look inside your bowel. A specialist doctor may take a biopsy, a small piece of tissue, from your bowel lining for examination in a laboratory. This test helps to rule out more serious conditions. Self-help. Diet advice. For most people with IBS, a healthy lifestyle is the best way to improve symptoms. Eat regular meals. 6 small meals throughout the day may be better than 2 or 3 large ones. Drink plenty of water. Limit caffeinated drinks such as tea, coffee and energy drinks. Cut down on foods rich in insoluble fiber, such as wholemeal bread, whole grain rice and cereals containing bran. Eat no more than 3 portions of fruit a day. If you have diarrhea, cut out the artificial sweetener sorbitol. This is used in some sugar-free sweets and drinks, and diet products. Psyllium supplements may help relieve constipation. Bloating symptoms may be improved by eating oats, which are found in some cereals and porridge, and a tablespoon of linseeds each day.